Between the femur and the tibia, two cartilaginous crescent-shaped wedges known as the meniscus are present. The menisci cover 2/3 of the tibial plateau. The two crescents are on the medial and lateral portions of the knee joint. The outer edges of the meniscus are thicker and help with the structural and articular integrity of the knee. Meniscal tears occur during weight-bearing compression and twisting of the knee. These forces and the grinding of the bones cause the meniscus to tear. With tearing of the meniscus, its ability to function as an articulation component and shock absorber are compromised. There are 4 different types of meniscal tears. In picture A, we have what a normal meniscus would look like, strong and healthy. B is a longitudinal tear, which happens along the length of the meniscus. C is a bucket handle tear, where part of the cartilage detaches from the tibia, leaving a flap of cartilage. D shows a radial tear that starts at the outer edge of the cartilage and comes inwards. And E, a degenerative change. The cartilage wears away, losing its smooth surface, becoming brittle and thin. Symptoms of a meniscus tear depend on the size and location of the tear and whether other knee injuries occurred along with it. Since there are no nerve endings to the meniscus, pain is due to swelling and injury to surrounding tissues. Depending on the severity of the tear, pain will likely be on the side of the knee where the meniscus was torn. Swelling will increase gradually and limit bending and twisting. Pieces of the torn meniscus can float into the joint and cause a clicking or popping sound, which can lead to a wobbly feeling and the knee giving away without notice. If other ligaments have torn as well, this will increase pain and swelling and the ability to walk. The gold standard test for a clinician to diagnose a meniscal tear is called the Thessaly Test, in which the patient will stand on one leg on the affected side and bend the knee at varying degrees while supported by the clinician and twist side to side to try and reproduce the symptoms of pain. For minor to moderate tears, treatment includes rest, ice, compression, and elevation, and physical therapy. A knee brace may be used to facilitate stability and proper healing. Recovery time is based on the individual situation. For more serious tears, a surgical route needs to be taken. In some cases, the meniscus can be sewn back together, but with severe tearing, the damaged portions will be removed completely.